You're watching Let's Chat.
Odds are you or someone you know has suffered a stroke. Odds also are a little bit higher if someone you know hasn't had a stroke, that someone you do know will have one at an alarming rate. And that's why we're observing month as National Stroke Prevention Month. And for that, we turn to the expert. It is the Dr. Tom Devlin.
Thank you, Chip. Thank you so much.
Good to see you. In reviewing some of Dr. Devlin's medical credentials, I'm firmly convinced you should be on the Mount Rushmore of medicine.
Well, I don't know about that, Chip.
Firmly convinced you should be on the Mount Rushmore of medicine.
Thank you.
You are just such a leader and a pioneer in all things neurosurgery. You should also be on paper currency. He's literally a god in the stroke world.
Well,
if you don't believe me, ask any of his patients.
But I'll tell you, what's important about this, Chip, is we happen to live in the area of the country that has the very highest incidence of stroke anywhere in the U.S. So this is Stroke Awareness Month, and I got some good news on two fronts. Number one, this is what everybody just needs to remember. Number one, stroke is very preventable. Number one, and two, it's very treatable. There is no worse condition in all of medicine than stroke. Why is that? It's the number one cause of adult disability.
Wow.
And the key thing, very simply, is there is no more time-sensitive condition in all of medicine than stroke. So everybody needs to remember what the stroke symptoms are, and that's very easy to remember. Just remember the word BEFAST, B-E-F-A-S-T.
Got it.
The B is for sudden onset of balance problems. I can't walk. My balance is a problem. So B. E is for your eyes, sudden loss of vision in one or both eyes. The F is for face, if you develop or someone that you see develops a facial droop.
Right.
A is for arm, if you develop weakness on one side. S is for speech. Either I can't get my words out at all or my speech is slurred. And the T is for time. If you see someone or this happens to yourself, it doesn't mean definitely that you're having a stroke, but it could be. So the T is for time. What do? Don't call Chip, don't call Dr. Devlin, call 911.
Right.
That's what they have to remember. Be fast. Those are the symptoms.
Now, you can also lose, and every time Dr. Devlin visits, I learn something new. 2 million brain cells. 2 million brain cells, not every hour during the stroke process,
right?
Every minute.
Absolutely. So that comes to the fact that it's a very treatable disease, but it's very time sensitive. Chip, that translates into 447 miles of brain fiber every hour. So you got to call 911. Don't call your doctor. Don't tell your wife not to call EMS. Call 911, get in quickly. And it's a very treatable condition. We can give you a clot-busting medicine up to 4.5 hours after symptom onset, but the sooner we give it, the better. And if there's a clot up in the brain, we know that we can actually go up into the brain, in some cases, and grab the clot and pull it out. But that has to be done quickly. So you have to remember, you have to go to a center. CHI Memorial has more treatment options than any other center in the region, and there's no hospital in the world that can do anything more for stroke than we can do at CHI Memorial. But it's very time sensitive.
And that is in large part to the work that you and your team have put forth going back several years. I can't tell you how much this guy has advanced the treatment, the diagnosis, and the everything else having to do with stroke and stroke symptoms in a few short years. You thought I was kidding when I said you should be on the Mount Rushmore of medicine. I'm not. What you have done single-handedly is simply amazing.
Well, I have a saying, if you want to go fast, go by yourself. If you want to go far, go with a team. So what I would say to you is, it's really not been about me. It's been about the whole team of people that have come together. And the reason why we've built a team so successfully in Chattanooga is this is an amazing city. We have EMS on board. We have our outside hospitals on board. We have our nurses, our ER doctors. It's been, and hospital administrations like CHI Memorial, we have built a team to be able to take care of this 24/7, 365.
A lot of times when you're in that situation where you need 911, where you need an ambulance, you're not thinking clearly.
Right.
And they could take you anywhere they want. So
Correct.
you have to be pretty insistent. I want to go to CHI Memorial.
Yeah, I appreciate you saying that. You know, we do a lot of clinical research, and we have a lot of other treatment options that other hospitals don't have. For example, we have clot busting medicine that we're developing. If you come in past the 4.5-hour window, we can't really give you a medicine that's approved. We can put you in a clinical trial, though, and you can get one of these new research drugs that we can give up to 24 after onset of stroke symptoms that are very safe, that can help potentially dissolve your clot. So one of the, and keep in mind, what is research yesterday is today's treatment.
Good point.
So if you come, you know that you will get every possible opportunity to get better. And now the key thing is, the best way to treat a stroke is never to have the stroke to begin with.
And you can find out so much more. How much time do we have left, Jamaica? I think we're running out of time, although I could sit here and talk with you for hours.
Just go to your doctor, get all of your risk factors treated. Blood pressure, diabetes, don't smoke, sleep apnea, overweight. Work with your doctor, get your risk factors well controlled to never have that stroke. 80% of strokes are preventable.
And should you find yourself in that situation, there is no better place to go than Memorial. It is memorial.org/stroke, memorial.org/stroke. Dr. Tom Devlin, good to see you as always.
Thank you, sir.
And the door is always open here for you. Stick around. We're going to go to the Chattanooga Zoo, or actually the Chattanooga Zoo is coming to us next here on Let's Chat.